Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. I'm going to show you how to scan the plantar fascia. So it's super important that your patient is prone with the ankle hanging off the end of the table, the foot hanging off the end of the exam table. Your landmark is going to be the inferior calcaneus, the plantar aspect of the calcaneus for this plantar fascia. The orientation of the probe is long on the foot, and the movements are going to be slight movements medially and laterally, and then also some angulations to make sure you get a very, very bright calcaneus. The area of interest is going to be the 3, 4, or 5 millimeters of tissue sitting just superficial to the calcaneus. I'm going to show you how to scan and inject the plantar fascia. Our patient positioning in our group is preferably with a patient prone, however different practitioners may have different setups. The landmark is going to be the bottom of the calcaneus, and the movement of the probe is going to be towards the toes. You can see the orientation of the probe is long on the foot. The yellow arrow is now centered inside the plantar fascia. If I were going to do the injection, I would simply spin the probe like this. Well, the yellow arrow is still within the center of the plantar fascia. My needle angle of entry is from medial to lateral, having placed enough anesthetic in the skin to make it less painful for the patient. There is some disagreement between doctors about where to place cortisone, for example. Many radiologists advocate placing it directly in the center of the plantar fascia, while some prefer to place it superficial to the plantar fascia. Some may argue that if you place it superficial to the plantar fascia, you may get fat atrophy or fat lipodystrophy. So therefore, some prefer to place it deep to the plantar fascia. In that case, you would simply slide towards the toes. We now see the deepest aspect of the plantar fascia here, and you can place it, the cortisone, in the interface between the plantar fascia and the underlying foot musculature. So that's how I would scan and inject the plantar fascia.